Hey guys, Dr. Barr here, a bariatric surgeon in Dallas, Texas. And today I want to talk to you about a common post-op complaint called stitch pain. For minimally invasive bariatric surgery, we can usually perform the entire procedure through 4 or 5 small incisions. These can range from as small as about 5 millimeters, which is like pinky nail size, up to 12 to 15 millimeters, which is around the size of my thumb. Obviously, after surgery, some pain is expected, but it can be scary and confusing when one of your incisions is acting way different than the rest of them. A common reason for this is called stitch pain. When we make these cuts in the abdominal wall, there's always a future risk of hernia formation in that spot. The risk is really low for the smallest incision and gets higher as the incision gets bigger. To help reduce this risk in larger incisions, we use a suture to close the deeper, strong connective tissue layer called the fascia. This stitch holds that incision together so that nothing can get caught in it and reduces the risk of hernia formation in the future. By convention, surgeons usually only use these stitches in cuts greater than 12 millimeters or the size of my thumb. The fascia itself doesn't stretch that much, so when we tie those stitches, it can feel like a sharp or pulling pain, especially when you cough, laugh, or get up or use your muscles. This is very common, and while painful, it's completely safe. This is different from other types of abdominal pain since it usually only hurts with movement and goes away with some heat or cold. It also can sometimes cause muscle spasms, and a muscle relaxer can sometimes be helpful. It should not have any associated fevers surrounding redness, drainage, or increased heat, which can all be signs of infection. If you're having any of those things, you should talk to your doctor about being seen or for an assessment and possible treatment. The good news is that this pain is temporary and your body heals over the next couple of weeks. The tissue relaxes and the discomfort fades. Also, the stitch that most surgeons use is dissolvable after anywhere from 90 to 100 days. So stick with it, and time heals all wounds. Remember to like and follow for all things bariatric surgery, and if you're looking for a surgeon in Dallas, Texas, you can see us at DFW Bariatrics and General Surgery.